conversation. Good morning, doctor.
Good morning, good morning, good morning. How are you? You're looking good.
Very
well,
too.
thank you.
Good morning, sir. How are you?
All right, take it away from here now.
We're good. Thank you very much. Good morning, viewers. Welcome back to another edition of Kakaki Cancer Awareness with Dr. Denise Ejo, the CEO of Comwood Cancer Foundation, in partnership with AIT. Together we fight, together we win. We thank you all for championing our cause. So today, what are we going to be talking about? Thank you, viewers, for joining us once again. What is our topic? We're looking at the Nigerian cancer centers, the Maiduguri service provision. So we're starting our service provision, and this time we're trying to get everybody to know where you can get help. Who have I got in the house? I've got in the house Professor Adije. I hope I pronounced that correctly because I actually did a lot of homework. Prof, good morning.
Morning, how are you, Denise?
I'm fine, thank you. And how are you doing? How's Maiduguri?
Well, Maiduguri is great. The weather is very good. It's raining most of the days now.
So it's not that hot then?
At all, the temperatures are very down. Virtually every day is raining.
Oh, wow. That's nice to hear. Okay. So let's go. At Comwood Cancer Foundation, we want to say that we're still doing our giveaways. And just to let you know, the July giveaway has been taken. It was taken yesterday. And our recipients will be posting on our social media handle. If you want to be part of that, please make sure you are in it. If you're not in it, you can't get the giveaway. Let's go. So next one is in August. We'll see you then. Let's start our conversation. Share, follow, subscribe to the Comwood Cancer Foundation as I introduce properly and officially Professor Ahmed Adijo. Prof is an international. Please, for the course of this conversation, he will be referred to as Prof because that's how I know him. Prof is an international scholar of repute, a professor of radiology and at the Department of Radiology, University of Maiduguri Teaching Hospital, and he is currently the Chief Medical Director at the University of Maiduguri Teaching Hospital, which is in Borno State. He has worked for over 29 years at the university and has a working experience outside Nigeria as a radiologist in the World Health Organization at Geneva, to name a few. Prof has held positions and received many prizes and awards within and outside Nigeria. He is a recipient of the National Productivity Order of the Merit Award by the President of the Federal Republic of Nigeria. On appointment as the CMD University of Maiduguri, he repositioned the hospital to become the largest hospital in Nigeria with 1,305 bed capacity from 630 bedded hospital. He built many specialized centers of excellence in the hospital, including the most modern cancer center in West Africa. Over 30 projects have been attributed to him in the last 4 years of his tenure as the Director of University of Maiduguri Teaching Hospital. Thank you, Prof. Good morning. Once again, viewers, good morning, Prof. Thank you for your time. I do not take it for granted. I know you are very, very, very busy, but you have continually tried to make time for me to have this interview. So we really, as Nigerians, especially cancer patients, appreciate you for your time and your availability to be with us today.
Thank you very much.
So let's sit back now, viewers, and let's now listen and let's learn a bit more about what's going on in the cancer space. So, Prof, I'm going to start my questions now. The first one says, what specific cancer center treatment and services are offered at the Maiduguri Cancer Center?
Thank you very much. I appreciate the invitation. Similarly, I don't take it for granted. I think there is a lot of commitment by you and the AIT to ensure that cancer is managed well for the betterment or improvement of quality of life of our patients. I think I have to thank you for all the good works you are doing, because because communication is one of the things that really helps in cancer management. We all know the challenges of finance and communication. Many things can come up. We know the challenges of equipment, the challenges of human resources. With proper communication, I think we can all overcome some things. At the University of Maiduguri Teaching Hospital, we really commissioned the Cancer Center in March 2023. And there are many forms of services at the University of Maiduguri Teaching Hospital. We all know the cancer treatment is not restricted to radiotherapy, as many tend to believe, but if you start from the basic chemotherapy. So at the University of Maiduguri Teaching Hospital, we provide chemotherapy services for decades to our cancer patients. And similarly, we all know that if you have a tumor that you need to remove, and you must undergo some level of surgery. So we have surgical services for cancer patients at the University of Maiduguri Teaching Hospital. And also, there are hormone therapy for cancer patients, which we also provide hormone therapy at the University of Maiduguri Teaching Hospital. Another rare form of cancer treatment that we provide is through interventional radiology, properly targeted therapies, in which using interventional radiology techniques and image guidance, we can rightly introduce a chemotherapeutic agent directly to the lesion. And also, we can't use radionuclide directly into the lesion so that there won't be destruction of the cancer cells. And lastly, among the things that we do is the radiotherapy or the clinical oncology, in which we provide radiation into the cancer cells so that we can kill the cancer cells and improve the quality of patients. I think the only two areas that we are working on to see that we really add to our services is the immunotherapy that we really want to add into the system, and also the stem cell therapy for cancer patients. These are the two other services that we have not yet started for cancer. So thank you very much.
Thank you, Prof. Wow, you've gone far, because I was just thinking about all the things you said, and I realized I think I've done most of them. And I just had my first, what did you call it? Radio, how do you call it now? Stereostatic radiotherapy, radiosurgery, right? That's it. What did you call it? Interventional. That's what you called it. I've had it. I had it about 2 months ago in my brain. I just had another surgery, this one that you call, but I think they call it stereostatic or something like that too. But yeah.
We have stereotactic surgery or radiobiology, which is used as a form of surgery without using the knife.
Bam.
In the accelerators. But the interventional radiology, it uses usually chemotherapy that we give is a systemic chemotherapy. And that systemic chemotherapy have a lot of side effects because it's going generally into your blood system. But when you have targeted chemotherapy right into the cancer tumor, you use catheters under image guidance of angiography or TSA, we will just go in straight and introduce the chemotherapeutic agents, either doxorubicin or other form of chemotherapy agents, to the tumor straight, especially what we call the HACE, the hepatic artery chemoembolization program, which we do here at the University of Maiduguri Teaching Hospital, so that we can fight cancer cells directly without affecting the other systems. General challenges of chemotherapy are overcome. So that's it, which is slightly different from the stereotype. We also have our machine is the only machine, I think, now in the West Africa that can do stereotactic surgery. Because we have the Electra H reverser. This is the one on the image. You can
That's
see
the
it,
one.
and it can do stereotactic surgery in addition to the radiotherapy. Thank you.
Thank you. That's the one. I saw it. Yeah, that's the one. You know, I'm not a doctor, so whenever I see these things, it fascinates me. I'm very proud of this because at least I can actually tell my consultant we have this in Nigeria. Okay, let's go to the next question. How accessible is the Maiduguri Cancer Center for patients from various parts of Borno State and Nigeria?
Yeah, the Maiduguri, we all know, is located in the northeastern part of Nigeria. And it used to be the capital of the northeastern states. And there is an international airport at Maiduguri with daily 3 to 4 flights. Mainly we have the Runner Air, we have Air Peace, we have Max Air, and Ari. So it is accessible by air and also is accessible by road. And so far we have patients from 6 countries. Very surprising. Patients from 6 countries have attended treatment at the facility at University of Maiduguri Teaching Hospital. We have patients from Cameroon, from Niger, from Chad, from Benin Republic, from Togo, from Sierra Leone, okay, and all other parts of the country they come, not because of anything, but because of 2 things: the cheap services and the most modern equipments. The most modern equipments gives us more accuracy of the delivery of the radiation dose. So Maiduguri is very accessible by air, and University of Maiduguri Teaching Hospital is also a place that is within the center of the town. And, I think it's very, very accessible. Thank you very much.
Awesome. Thank you. Thank you. Yes, I know that. I know a degree. I know a good degree. So let's go. The next one. What measures are in place to ensure the affordability of the cancer treatments for patients in Maiduguri? And what I'm looking at is looking at those that, this cancer health fund is a real challenging statement, because it only provides support for three cancers in the 6 national hospitals. So I don't even know how a cancer patient will get a discount in your hospital. That's what we're trying to ask.
Yeah, in the first place, I think you will be more aware than anybody else that the cancer treatment generally in Nigeria is highly subsidized. If you compare the cost of cancer treatment in Nigeria and other countries, you realize that in Nigeria is still very cheap, despite the huge amount that we see. These machines are very, very expensive, and the maintenance of the machines are very, very expensive. If one have to go by charging to sustain the facility only, I think there is no cancer center that will charge for linear accelerator services less than 2 million per treatment session. So most of it, the federal government in the public hospital is buying the machines. Most of the time is free. And the federal government is paying the staff salaries free, and some level of maintenance of these machines. So that's why some of the charges are very, very low compared to the other countries. And also in Nigeria so far, I think our center, University of Maiduguri Teaching Hospital, is the cheapest, because we look at the socioeconomic condition of our people after having all the security challenges. So it's going to be difficult for them to afford to pay if it is very high. As of now, for linear accelerator services, we charge about 500 300,000, and for brachytherapy services is about 200,000. I believe you know it yourself, and it's unlikely that we have any center that charges such amounts. So to come to what you mentioned, particularly the Cancer Health Fund, I think it's a very good thing that has happened. Though it has its own challenges, but certainly patients have benefited immensely from the Cancer Health Fund. And we have to thank all the other donor agencies that work with health funds to ensure cancer patients benefit. But there is need to expand this Cancer Health Fund, as currently there are only 6 centers, I believe, that are within the benefits. Patients more treated within these 6 centers to benefit. That include the University College Hospital Ibadan, the National Hospital Abuja, the Maiduguri University Zaria, and some other 3 more, Benin City and Enugu. I think this another one. So there are about 6 centers. They are the ones that benefit from the Cancer Health Fund. We discussed recently, I think there is need to expand. Our own institution is not one of the beneficiaries as of now, but I believe they are working hard to ensure that they are also included among those that will benefit from this form of funding to the patients. It's about 2 million, I think. And patients' treatment, some level of investigations and services are covered within that treatment option. So University of Maiduguri Hospital is working hard with the National Cancer Institute to ensure we are also beneficiaries of the CHF. I believe it will help go a long way in alleviating the suffering of the patient. But certainly there is need for more coverage of the various forms of cancers and increasing the amount of funding so that we all know how things are getting so expensive every day. So I think it's a very good thing by and large. We have from time to time some donors, philanthropists in the country who really wants to help. I believe they are helping, and it's very good. And I'm calling on many other Nigerians. They can also come, those that have the means, to come and see how they can open a account to discuss with the various cancer centers in the country to see how to help the cancer patients. We all know cancer is an expensive treatment when you compare it to so many other forms of treatment. If you are an average, even if you are an average Nigerian, I believe it will bring you down before you finish all the treatments that is required for cancer management. And it's good that we all come together and see how we can promote it. Those that have it in our society, the government, the NGOs, international partners, local partners, let's all come together and see how we can help our own people. I think that will help. Out-of-pocket expenses for cancer is very, very difficult. And even for the workers, I have to commend also the National Health Insurance Scheme. They're also giving some form of support to the cancer patients. But certainly there is need to expand these forms of support so that patients can get the maximum benefits. Thank you.
Thank you. Now I'm going to put my voice to this particular aspect and say, I am appealing to all stakeholders. Please help us. Help us. Prof, thank you for saying this. But as a cancer patient myself, I have to put my own voice to this. Please, can the CHF please get to Maiduguri since the facilities are there so that at least people in the area can access it. Please, it's highly required. It is, like Prof said, it's the most expensive disease, I think, in the world. So let's take it from there. Now, you've shown us a lot of we have seen a lot of your facilities. So can you describe No, I don't want that one. I'm going to go for, how does the Maiduguri Cancer Center, which is one that is very important, support patients' mental and emotional well-being? As you would appreciate. Yeah.
I think what you started, the question that you started is similarly very good.
Yeah, I wanted to do that next.
Okay, you want to put it next?
Yeah.
Okay, so you are talking about the support to psychosocial support to patients. I think the University of Maiduguri is a very standard university teaching hospital that has over 57 different departments, and there is a full department of mental health, 4 professors in the department, and services are rendered as part of psychosocial support and counseling to the cancer patients. So we educate them very well. We tell them what is actually disease, how it can be managed. They work together with the psychiatrist, and give standards as obtainable for best global practice when it comes to psychosocial support.
Awesome. Now,
center, and I believe it's very, very important, because many people believe that when you mention they are having cancer, it's like you have sentenced them to death. The first thing is, everything in the world, you feel like you are just moving on to the next world. It's like a death sentence, but it's not so. Many cancers are very curable. We have seen so many patients that have lived very long, and the quality of life that they live is very, very high. And some of the cancers, I believe, with time they will just like other forms of non-communicable diseases. Sciences are advancing, medicine is advancing, technology is advancing. So I don't think somebody will assume at this stage that having a cancer is a death sentence. And our own psychosocial support is very, very strong. Each patient that come, we educate the patients, we educate the relatives, we educate everybody, and we give them informed knowledge about the disease that they have. I think this is very, very important. Not only the doctor knowing it, but the patient that is suffering from the disease should also have the in-depth knowledge of the challenges having and all the treatment options, so that every decision that is made by the patient is going to be an informed decision. And also consent is obtained in virtually everything that we do at the center. I believe there is need at national level also to support the psychology aspect of the cancer. I think in many other places, they do neglect this aspect, but it's very, very important. You can imagine how a patient will feel. You will just give him a result that he's having cancer. Everything will just start having blurring and all of those things. It's good that we educate them very well. It's good that we give them information. It's good that we give them hope. And they will live a very good quality life with the level of medicine and technology that we have now.
I agree with you, Prof, on that, because I'm still here 8 years next month. So yes. I'm still taking the treatment, but I'm still here. So the last thing I want to ask you now as we close is I need you to please, can you describe the diagnostic facilities, these ones that we're seeing here? Can you tell us quickly about it?
The diagnosis of cancer is very, very wide. It starts from the clinical suspicion of the lesion or the symptoms that the patient presents with, or the signs that the patient that manifested with or presented with to the doctor. And it cut across virtually all disciplines of medicine, from gynecology, surgical oncology, dermatological oncology, pediatrics oncology, so ENT, ophthalmology, virtually every field of medicine is having its own forms of cancer. And the diagnosis starts from the doctor. He will look at the presenting features by the patient, and at the end of the day, you will have a provisional diagnosis. And based on the provisional diagnosis, some second level of investigation will go on based on blood tests, cytology, biopsies, X-rays, CT scan, MRI, and some smears, and all forms of laboratory and radiological investigations will be done. And this is most of them, we have them at University of Maiduguri Teaching Hospital. The radiology department is very, very strong. The laboratory, especially the histopathology department.
Sorry, Prof, our time is up now. Our time is up. I want to say a very big thank you to you, but I'm going to come back to you on this thing. You have really educated us. We want to say a very big thank you. Thank you, really, really, for telling us about this, because a lot of people didn't know you had this facility and we didn't know what you were offering. So honestly, I want to say thank you on behalf of all of us that have cancer for sharing this with us, and hopefully we'll come back to you again in the very near future.
Thank you very much. I really appreciate it.
Thank you. Thank you. Thank you all for joining us. Follow us all on our social media handles. We share various activities across the country as things are going on. Together we fight, together we win. Please, you can visit the Maiduguri University Teaching Hospital website and find out what's going on and their cancer center, so you are educated and you're informed. You know how to get the support you require. Follow us on all our social media handles. You can find us on our Instagram, Facebook, LinkedIn, anything. Just check for us there. And don't forget, our giveaway is on. August is the next month, and you will see it sometime in the middle of August when the time is up. So I want to thank you all viewers for joining us. We'll see you again next month as we look, hopefully we should have Her Excellency Zainab Shinkafi, who will be one of our guests next month. Take care of yourself. Have a fantastic, fantastic day. Thank you, Prof, once again for your time. I really, really appreciate it. Our message is very clear. Together we'll fight. Together we win.